How Diet Shapes Your Cardiovascular Health by Job, Joshua, and Kaylee.
Did you know cardiovascular disease is responsible for 31% of all deaths globally?
So what exactly is cardiovascular disease? Cardiovascular disease is actually a blanket term used to describe a group of disorders that affect the heart and blood vessels. This includes disorders such as heart attack, stroke, or atherosclerosis. Early symptoms may include discomfort in places such as the chest and arms, although occurrences are often spontaneous.
Some of the risk factors associated with cardiovascular disease include genetic factors, medical conditions such as obesity, high blood pressure, high cholesterol, and diabetes. More specifically, obesity increases the risk of heart disease by 78%. Alcohol use has the ability to increase levels of triglycerides. Tobacco use can damage the heart and blood vessels, which increases your risk for heart conditions such as atherosclerosis and heart attack. Physical inactivity contributes to 27% of CVD patients. Age and sex could also be risk factors of heart disease, in which it has been determined to be a primary cause of death amongst women specifically.
Why you should care. In 2023, the CDC, Center for Disease Control, found that over 900,000 people died from cardiovascular disease. That is 1 in every 3 deaths. Depending on the seriousness of the disease, the treatments can be as simple as changing your diet and exercise or having to get a heart transplant. There is also cost to consider. Based on a study by Kumar et al. In 2022, the average patient costs around $19,000, with inpatient cost being around 43% of that. This study was limited and didn't include patients who required surgical treatment, otherwise the cost would increase. The dietary contributors to cardiovascular health that we are focusing on here are water-soluble vitamins, fats and lipids, and carbohydrates. Water-soluble vitamins are essential vitamins that are soluble in water, making them easily absorbed and excreted. This includes vitamin C and B complex vitamins. Vitamin C is important for immune system function, serotonin production, and works as a powerful antioxidant. This can be found in most fruits and some vegetables. Vitamin B12 supports nervous system function and aids in the production of red blood cells. This can be found in meat, eggs, and dairy products. Vitamin B9 or folate is very important for mental health and brain function, and can be found in dark leafy green vegetables. A study in 2021 followed 216 patients for an extended period of time, while monitoring their health and diet. They found that an increase in deficiencies in water-soluble vitamins caused an increase in the risk for hospitalization due to cardiovascular-related reasons. This means that an increased intake of water-soluble vitamins, eliminating deficiencies, can increase cardiovascular health, and be used as a form of prevention against cardiovascular diseases. Another study from 2023 found that supplementation of folate, or vitamin B9, actually caused a decrease in plaque buildup in the carotid artery, an early sign of atherosclerosis. This research shows that water-soluble vitamins can be used not only as a dietary form of prevention, but also an early form of treatment. Fats and lipids are macronutrients. They are used as a source of energy, as part of the cell membrane structure, and to absorb fat-soluble vitamins A, D, E, and K. Triglycerides are the most common type of fat in the body, and they are an important factor in cardiovascular diseases. A study in 2025 by Liu et al. Analyzed data from 2012 to 2022 on Chinese adults with varying disabilities to see how triglyceride glucose affects both blood pressure and coronary heart disease risk. Mediation analysis showed that triglyceride glucose explained the association of the blood pressure and coronary heart disease at a 95% confidence interval, showing triglycerides' effects on cardiovascular diseases. Among fats, there are different kinds of fats such as saturated, unsaturated, and trans fat. The worst of them are trans fats. A meta-analysis by Mozaffarian, D. et al. In 2009 showed an increase in risk of coronary heart disease for every 2% increase in trans fatty acid consumption. So it would be better to eat more unsaturated than trans fats.
Diving deeper into carbohydrates, they are initially absorbed through the intestinal villi as monosaccharides, Then some of these carbohydrates go to the blood to contribute to blood glucose. The liver then takes all of this glucose and turns some of it into glycogen. But, the leftover carbs that didn't get used in this process turn into fat depots, which can be unsafe. Some of the functions of carbohydrates include acting as a source of fiber, spare protein, and a blood sugar regulator. But their main function is to provide energy for the body. A study from 2023 showed that high simple carbohydrate intake can have adverse effects on the incidence of CVD. This is because foods that contain high amounts of simple carbs raise triglyceride levels, which may increase your risk of cardiovascular disease. The results indicated that individuals with the highest carbohydrate intake had a 1.15-fold increased risk. How to avoid this risk? Research has shown that specifically low-carbohydrate diets have a beneficial effect on reducing cardiovascular risk factors by decreasing triglyceride levels, body weight, and blood pressure.